Another drug, not fentanyl, is now being mixed in with illegal drugs and leading to more overdoses. Dealers are now using a veterinary tranquilizer called Xylazine as filler added to drugs like fentanyl or heroin, methadone, cocaine. It has sedative effects like an opioid, but it's not, and it is now responsible for nearly 7% of overdose deaths. Dr. Christine Cauffield is with LSF Health Systems and is joining us this morning. Good morning. Thanks for being here.
Oh, my pleasure.
So, we're so accustomed to hearing about the dangers of fentanyl and then, of course, warning about that. But now there's this veterinary tranquilizer that's being used. Tranq dope, I believe, is how it's referred to it.
Exactly.
What makes this so dangerous?
It's very dangerous in that it has a sedative effect, just like our fentanyl does. And when mixed, it's deadly. And the unfortunate thing is that naloxone is not proven effective in reversing that overdose.
Yeah, so that's the Narcan that we frequently hear about that EMS and police carry with them in case they suspect that someone, and it literally, as you watch it take effect, it can literally bring somebody back from the brink of death.
Exactly.
And the fact that this doesn't work on that is certainly very frightening.
Very.
That said, is there something then that can be used to treat it, or is that why we're seeing this increase in overdose deaths?
It really is. It's part of the reason, because it's so sedative that, again, coupled with fentanyl, that cuts off the respiration, and if you don't have an effective agent to reverse that overdose, it's deadly. Another thing about Tranq dope, as it's called on the street, is that it causes very severe anemia. Also, it breaks down the tissues and very susceptible, those that are addicted to it, to serious wounds. So it's so dangerous, and we're very concerned that this is really hitting the market. Addicts are looking for this because they report that it really extends the euphoric effect of fentanyl.
So for those who have a loved one and they are worried about them or suspect that they might be using drugs, it's so hard to start that conversation and sit down. What suggestions do you have particularly for parents?
I would absolutely ask those tough questions. I'm worried about you. I see some changes that concern me. Look for symptoms or signs like a drop in drugs, a change in friends, isolation, disheveled appearance when the person used to be, all put together. These are some signs that something is wrong. Weight loss is another. So it's very important to say, I'm concerned, I'm wondering if you are using drugs, I'm here for you, let's get you some help.
And what are the options out there when it comes to health? Help. Can you explain the services then that LSF provides?
Absolutely. At LSF Health Systems, we have a network of providers that provide inpatient substance abuse treatment, detox services, methadone clinics, all sorts of different treatment modalities that can address addiction. And believe me, recovery is possible. Recovery happens so people don't have to suffer with the crippling effects of addiction.
There are many people who say, okay, I'm ready to get help, or a loved one who says, I'm ready to help someone that I care about get help. But a lot of times it's hard because it financially is just they feel or believe that they can't afford it.
Yes.
Is that the case always?
Well, it's a myth because thankfully at LSF Health Systems, we provide services for individuals that are indigent, uninsured, or underinsured. So no cost to that client, and help is available.
Dr. Cauffield, thank you for your time here. We appreciate it. And for, educating our viewers about the risks that are out there. And if you or someone you know, of course, needs help, you can call LSF's crisis hotline anytime. The number is 877-229-9098, or you can visit them online at lsfhealthsystems.org.